Okay, good afternoon, everybody, and welcome to Lifestyle Media Group's Lifestyle Live. Today's topic is beauty, health, and wellness beyond the new normal. I want to thank all of you for taking the time to listen in. My name is Jeff Dinitz. I'm the president of Lifestyle Media Group. I'd like to start by thanking everyone for joining us, especially our panel, Dr. Brad Glick, Dr. Shinobe Aguilera, and Dr. Tammy Fairman. Just to give you a little bit of background on Lifestyle Media Group, we are a monthly publication with 127,500 circulation and over 500,000 readership across 9 markets that strategically surround Fort Lauderdale and the Miami area. We are the largest print magazine company in South Florida. We also have a full digital company with a full array of products, everything from email blast, Facebook ads, native ads, geo-targeting, with some of the most competitive rates on the live. Today it's going to be a virtual webinar, but we do on-site events as well. And we also have a daily newsletter that we are now sending out since the coronavirus pandemic began, to over 45,000 addresses. It's a little housekeeping. After the, or during the discussion, you will be able to submit questions through the chat feature, and we will answer them at the end of the interview. As an added bonus, 3 people are going to win prize. Let you know how we're going to distribute those towards the end. I'd like to start by introducing our panelists. And I've gotten a chance to know all of them over the last year, and what a group we have. Dr. Brad Glick is a board-certified dermatologist and dermatologic surgeon with clinical and academic practices in South Florida. Dr. Glick is director of the dermatology residency at the Larkin Hospital, Palmetto Springs, and clinical assistant professor of dermatology at the Herbert Wertheim College of Medicine in Miami. Dr. Glick is also director investigator for GSI clinical research in Margate, Florida, as well as the incoming president for the Florida Society of Dermatology and Dermatologic Surgery. Welcome, Dr. Glick. It's great to have you.
Thanks so much for having me, Jeff.
Okay. Dr. Shinobe Aguilera is a multi-award winning, world-renowned invasive cosmetic dermatology. He has developed groundbreaking signature techniques in his multi-award winning aesthetic medical practice in Fort Lauderdale. He has over 17 years of advanced training in lasers and aesthetic medicine. He is a clinical researcher and a published author of medical literature. He is the former chief medical director of the dermatology residency program at Nova Southeastern University, an assistant professor of dermatology for Lake Erie College of Osteopathic Medicine and Universidad de Rosario in Bogota, Colombia. Welcome, Dr. Aguilera.
Thank you. It's an honor to be here.
Okay. Finally, our final panelist, Dr. Tammy Fairman. Dr. Tammy Fairman is a board-certified plastic surgeon of 25 years and founder of the Tammy M. Fairman Holistic Spa and Wellness Center. She is a woman's beauty and wellness expert. Events on topics related to redefining modern beauty and wellness from her unique vantage point as a holistically minded plastic surgeon. In addition to her very busy professional life, Dr. Fairman enjoys speaking and spending time with her 5 children and participating in local volunteer and philanthropic work that aims to support growing and strengthening a healthy and well community for all. I want to once again thank you, Tammy, and all of you for joining our panel.
Thank you, Jeff.
We're going to start this off by each panelist talking about their practice and areas of focus within the industry. So Dr. Glick, why don't you take it away?
I'm up first. Well, first of all, thank you to Lifestyle Media for having all of us here and for myself as well. I have to put a shout out to Shari Glatter, who has been my representative advertising with you for this period of time, and it's been fantastic, and it's a fantastic vehicle for my practice. So I just have to start with that. As well, I also have to just say that I hope everyone is well out there. This has been an absolutely unimaginable time. So I hope to everyone that's listening that your families are well and staying healthy. In terms of my practice, I too have been in practice for 25 years. Like Dr. Fairman, I can't believe you've been in practice for 25 years, Dr. Fairman. You certainly do not look like you've been in practice 25 years. My practice is a very well-rounded dermatology practice. We pretty much do everything. What I'm most proud of, especially most recently, in 2016, we moved our office to a freestanding building, which is about 6,000 square feet. Superficial radiation therapy in our practice. And I'm really proud of that as well, too, because it provides patients with another opportunity to treat skin cancer, which is a big issue. And I'm sure we'll talk a little bit about that later on. Procedures, my colleagues that are on with us today are certainly more in the area of, and so I really err to their expertise in those areas for the most part. And thanks for having me.
Thanks for joining us. Dr. Aguilera, you're up.
Hi, everyone. I'm a dermatologist here in Fort Lauderdale, Florida. I've been in this area almost 13 years on Las Olas Boulevard. I've been different type of physician. I've been a family practitioner. I've been a hospice doctor. And thanks to Dr. Glick here, I'm one of his protege. He gave me the chance and believe me and gave me the opportunity to pursue my dream to become a dermatologist. So everything I am, I owe it to this man right here. And I admire him and I look up to him. And even though we don't see each other a lot, the umbilical cord is still there between him and I. I'm 100% aesthetic dermatologist now since the last, I would say, maybe 11 years. I do not do life-saving procedures like Dr. Glick. I do life-changing procedures. So I want to thank you for giving me the opportunity to be on this panel, because in these uncertain times, what we need to do is get help from each other to survive, how to cope with this, and how to take risk in life, because this is the new normal, and we just need to learn how to get coping mechanisms to make all of us being life's warriors, survivors of this pandemic. Thank you.
Thank you, Doctor. Dr. Fairman, you're up.
Good morning, Jeff. Good morning, everyone. Thank you to Jeff and Lifestyle Media Group for having me here today. Thank you so much. I'm honored to share the panel with Dr. Glick and Dr. Aguilera, two very esteemed colleagues. So as Jeff had mentioned, I've been in practice for over 20 years, about 25 years, and I'm a board certified plastic surgeon, and I transitioned from reconstructive surgery 100% cosmetic practice. And what I realized throughout my years of working is that there was something missing in the traditional plastic surgery as I had learned it and as I was practicing it. I realized in my own life that I was overworked, overstressed, overwhelmed with raising 5 young kids, being an entrepreneur, creating my own business, quite challenging, very busy. And I realized that I had forgotten to really incorporate all of the wellness tools that I had grown up with due to my multicultural background, where I was born in Israel to South American parents and raised in New York, and became fluent in multiple languages, English, Hebrew, Spanish, French. So all of that really allowed me to connect in a much deeper level with my clientele and my patients. And so what I realized was that I wanted to work beyond the scalpel. I wanted to work deeper. I wanted to support my patients in having these life-changing transformations on the wellness tools for myself, self-love, self-care, simple rituals, sometimes as simple as just taking those 5 minutes to have a hot tea with a little herbal tincture that is healing, to connect with myself. And really, my work is as a holistic plastic surgeon, treating the mind, body, and soul. And lastly, I don't really resonate with the phrase anti-aging that the media puts out. I like more in the lines of consciously aging. And so what I do is I invite my patients to look at beauty and wellness in their life and how to age consciously, because we're not anti anything. We all want to age. We just want to age well and healthily. So thank you for this opportunity to share a little bit with all of you.
Thank you, Tammy. You know, one of the things we've noticed is on Zoom, nobody's happy with the way they look and how they're aging. So wanted to hop into some questions for all of you. Dr. Glick, I'm not only a patient, you're not only a customer of mine, but I became a patient of yours. And you've got a great team and staff of people over there, and I've really enjoyed getting to know you over the past few months. What would you say are the 3 most important messages you want to convey to the audience today?
Very broad question. I think the first one is something that I mentioned a little bit already, and that just really hoping that everyone kind of follows the new normal, the guidelines, to be safe, to be well. To mention again that hopefully that those who've been sick or still sick are on the mend, and those that have passed away in this pandemic, you know, our prayers are with all of you. I think that's really important to me to mention that, because it's really a different time right now. People have been enclosed inside, and some people have been out a little bit more. I've seen a good amount of sunburns, actually. And one of the messages I want to convey today is to remind everyone that skin cancer in the United States is an epidemic. I want to remind everyone that when they get out there safely. Try and get out before 10 o'clock in the morning or after 4 o'clock. Controversy about sunscreen, and I can spend a lot of time talking about the pluses and minuses, and in fact, there really are no minuses to wearing sunscreen, at least a 30. My recommendation is a 50 or higher. There's a lot of literature right now supporting higher numbers. It used to be that it was thought that anything above an SPF of 30 wasn't beneficial, but there's some data to suggest that it is beneficial. And we now know that even an SPF 100 is clearly better than an SPF 50. So I want to remind everyone to apply their sunscreen, reapply their sunscreen every couple of hours. And vitamin D is kind of a hot button. It's been a hot button for the last, 5, 8, 10 years. There's vitamin D deficiency is rampant in the United States. In other countries, it's not. And ironically, there's some data that just came out yesterday that talks about the benefits of vitamin D potentially in this pandemic. And so I think all of us should very likely be taking vitamin D. And at minimum, I want to convey to the audience that they should consult with their physicians and check their vitamin D levels. I want to remind everyone about the ABCDs of melanoma. I actually have a little picture here. I was going to do a little show and tell. A, B, C, D, E. Melanoma in a lifetime. And that really scares me. So everyone should get at least a 1 year. Particularly Caucasian women ages 20 to 40. Asymmetry, border, color, multiple colors, diameter greater than 6 millimeters. But the most important one to me at times is the E. It doesn't get talked about a lot. And that's the evolution of a spot, a mole, a growth. Anything that concerns you should be brought to the attention of your doctor, or certainly those of us that care for skin, your dermatologist, your board certified dermatologist. And I guess the third and very important thing that I wanted to convey, in this last couple of months, our practices have been shut down. I've mainly been seeing emergency. I think my colleagues have been seeing emergent cases as well. And aesthetic medicine, cosmetic medicine has kind of been shut down. It's been called non-essential. And I'm not so sure that I agree with that, because I think health and beauty and wellness are all intertwined. And I think we need to bring that together. And as we move forward, and I think my colleagues will share this with the entire audience, that they are integrated. They're a part of our overall health. We look good on the outside, then we feel good on the inside. And so with that, I'll stop.
Thanks, Dr. Glick. Dr. Aguilera, I had the pleasure of being at a SFBW CEO Connect in December and watched you with our chairman, Gary Press. I was blown away. Your story, it was just, it was amazing. And I was really happy that I was able to attend that, and so was everybody else in the room. I've also had a chance to spend time with Lauren and other members of your staff, and you have what a great team. It was fun going out to lunch with them, and I can only imagine how hard this has to be on them not being in the office every day because of the camaraderie that you all share. What tools and protocols do you plan to provide for your patients moving forward as you address their aesthetic needs?
Well, we are very lucky that our practice, it may be one of the safest places to be, because since we always worry that needs to be injected, need to be disposed in a certain ways, we already were doing our part, following OSHA guidelines to have a place that will reduce the risk of infection from the procedures that we do. Now we have to do even more so. So we have done several protocols on our practice. We just started working on Monday, where we really have a lengthy questionnaire to try to survey the patients and find out if they're being exposed or have been in contact with anybody with COVID-19. Or every patient, we actually downloaded or created an app that they need to download. And through the app, we will let them know when they're ready to come into the practice. When they come to the practice, they're going to be received outside the door, and the temperature is going to be taken, and a questionnaire is going to be, a bunch of questions going to be asked to them to make sure that they haven't been exposed. Once they come in through the doors, if they don't have a mask, we'll provide one for them, and then we also sanitize their hand. There's no longer, in my practice, we don't have front desk team. That doesn't exist anymore. They are taken immediately to the room, and any will not be able to pass by each other. So this makes me not be able to see, even though we're really full right now, we have 50% capacity, and this is going to be a full schedule, because we need to make sure that we follow this protocol to reduce the risk of contamination or infection. The only thing that I try to, as a physician, give them tools. So there's a lot of conversations, mainly on the spiritual level, but also tools to help them to learn how to live with risk, because this is the new normal. I don't think this virus is going to ever go away. I think we're gonna need to learn how to coexist. So give them tools to reduce fear. If you live with fear, all you do is make yourself susceptible. Giving tools how to also survive. I talk a lot about who or what kind of people should you associate in order to continue to make you drop some levels down. Some people were starting new ventures and career, and they have lost everything. All of these are things that needs to be discussed in the room to make sure that the patient have tools to survive this pandemic. We need to become life warriors. And as a physician, not only because I do aesthetics, it doesn't mean that I can give them other tools besides make them feel better about themselves. Because as I mentioned before, I do life-changing procedures. It's bad enough that we are all going through a lot right now, and looking bad also affects your psyche. So I think, like Dr. Glick said, I don't consider myself non-essential, because what I do is very essential for the well-being of all of my patients. So what I'm trying to do right now, not only have protocols for the patient to feel safe when they come in, but I'm trying to do everything I can now that I have the time That's what we need to do. We need to learn how to live with risk and how to survive.
Thank you, Doctor. Dr. Fairman, I got to know you over the years, various functions, met members of your family. They're great. We shared stories about your education in Israel, and we were able to relate to a lot of same type of stories. So it's been great getting to know you, and having been spending so much time in Weston, you're a household name in that town. What messaging do you have for patients, and what interventions will you provide for your patients as we continue to navigate through COVID-19?
Thank you, Jeff. And I'm appreciative of our relationship, our business and professional relationship and personal relationship all these years. I echo what Dr. Aguilera said about us not being non-essential, meaning the work that we do, the three of us really, whether it's medical or aesthetic, is absolutely essential and vital to our well-being. And I invite everybody to, because of this pandemic, because of COVID-19, to really have a permission to pause in our life. This is what I noticed that the virus has done for me and my family and within myself, to really take the time to think and decide, how do I want to live out the best life that I have, become the best version of myself? So definitely the safety protocols are very important. That's what Dr. Aguilera mentioned. And we do really the same protocols that Dr. Aguilera has, and really having the trust of our clientele. I have to tell you, it's been a beautiful experience getting back into the office this week, because everybody is really comfortable coming in, because they trust that we're going to deliver, of course, that safe environment. In terms of the work that I do, many times you'll hear with my name, or you'll see in the beautiful editorials and articles and ads that we do in your publications, that I'm a holistic plastic surgeon. And as I was alluding to before, my main philosophy that I know to be true, not just on a professional basis, but on a personal basis that I've lived, is that beauty and wellness are deeply interconnected and intertwined. And so I wanted to offer my patients the life-changing. Of course, there are many things that we can't improve upon without a surgery, and that's why this field exists, and it's a beautiful thing. But I wanted to move beyond the scalpel. I really want my patients to consider the body, mind, and soul approach to wellness and well-being. And so this is really a paradigm shift in just the outside and thinking of vanity or superficiality. We are interconnecting and bonding together beauty and wellness, so that it might resonate for you and some of our viewers today, that when we feel good, we look good. And when we look good, we feel good. And you'll see people who are just looking so glowing, like my two colleagues over here, and just looking vibrant. And that is beyond the aesthetics. It's the aesthetics, but it's also all of that inner work that we do. So what is that inner work that I'm talking about? These are the holistic modalities that I created in 2017. I created a holistic spine wellness center in my space so that I can help nurture my patients in creating this mind, body, and soul approach for themselves. So that means the holistic facials, the massages, acupuncture, of course, looking at nutrition and exercise lifestyle, and then even having the deeper conversations with my patients, like Dr. Aguilera is doing in supporting them regarding their life. Question of, what does it look like to be the best version of yourself? What would that look like for yourself? And are you there at this time? Well, most of us will dare to say that we're not there yet. We're working on it. But what a beautiful opportunity for people to start looking inwardly, to take this time of pausing during the pandemic, to really decide, how am I going to look at beauty and wellness for myself? And where are the areas in my life that I might be missing a little bit of creating more wellness and beauty? So my invitation is for everyone to really become a creator of their best life, as Oprah likes to say, love to quote Oprah, and becoming the best version of yourself. And that's going to include, for some people, sometimes surgery, of course. You know, if you've maximized your diet and exercise, gone to the gym, and you're in optimal weight, there are areas where we need to address things surgically, especially in body contouring. And then it's also going to be incorporating the healing modalities of self-care, self-love, and we cannot underestimate that. So I'll give you just a quick example, and I'll close up. Yesterday was the end of my first week at work, was quite busy and you know, a little bit anxiety provoking to make sure we have all the safety protocols and doing the right thing by everyone. And I got home, went to take a shower before having dinner with the kids. And instead of making it just that quickie shower of just 1 minute in and out, I decided to take a few extra minutes to do one of the rituals that I love to do, which is using a honey manuka balm on my face with a little brush that affords lymphatic drainage. So what you're doing when you're taking those couple of minutes of that self-love and self-care, you're connecting with yourself. You are stimulating your skin, so you're doing something for your body physically, but you're also stimulating all those stuff, which boosts your immune system. And this is really what we need right now. So lastly, I invite you all to consider, what can you do for yourself? Just start with one thing a day where you're incorporating a non-negotiable, something that you decided, I need this every single day to start walking towards the best version of myself. It might be a 5-minute, you know, herbal tea. I'll give you my tips. What I do, a little herbal tea with an herbal tincture that are healing components of plants that help balance our body. It might be listening to a meditation app if you need that kind of support. You know, meditation is a huge stress relief and again, stimulates those feel-good hormones. And lastly, if you do nothing else but walk past your mirror once a day, look at yourself, really look at yourself, smile lovingly at yourself and tell yourself that you matter, that you count, that you love yourself. You are getting a dopamine surge and you're starting that connection between your physical self, your mind, your body, and your soul. Thank you.
Thank you so much. I'm sure the president of our SFBW, Clayton Idle, loved that part about walking in front of the mirror, for those that know him. A lot of questions are coming in, and I expected this. Dr. Glick, all of us, or a lot of us that have moved down from New York because we just wanted to be in Florida and stay in the sun, what is the #1 skin condition we should be looking out for to have checked out for melanoma?
You know, it's interesting. I saw that question in the chat. I actually sent up an answer, but we'll answer it to everyone. It's not so much a condition. I like to really say here that there are 3 things that everyone should know. There are 3 types of skin cancer: basal cell, squamous cell, melanoma. The first 2, and really all 3 of them, are derived from different parts of our skin. And they look a little differently. A basal cell is kind of a shiny pimple. It doesn't go away. Any skin lesion that is around your body, anywhere, because skin cancer can occur anywhere from nose to toes, that has been growing and it's not healed within a month maximum, is warrant for concern and to see your doctor. A squamous cell carcinoma, the second most common form of skin cancer, because skin cancer in general, and especially basal cell carcinoma, is the most common malignancy of all in the entire world. Squamous cell carcinomas kind of look like a pink scaly wart. It doesn't go away. Anything that doesn't go away is warrant for concern. Again, 2 to 4 weeks. Melanoma, the most concerning one, which has been mentioned here, it's really a mole. It's usually like a light brown or dark brown spot. It can be filled with multiple colors. It can vary in size. It can be flat. It can be raised. But once again, if you haven't seen it before, you need to bring it to your physician's attention or see your dermatologist. So it's not so much what condition, it's, I think what the attendee is asking is what to look out for. And that's what to look out for. And when I went over those A, B, C, D, E's, the evolution of the mole, the evolution of the spot is crucial. You could have had a spot for 5 years or 8 years or 10 years. I've had patients come in and said, oh, leave that alone. I've had that for 30 years. But if there is a change, if it starts to itch, it was flat, it raised up, it was brown, now it's brown red, and blue, there's something wrong. And we're lucky we have these tools in our practices now called dermatoscopes. They're handheld devices. Actually, I happen to have mine right here before I came onto this Zoom meeting. And we use these to help us more carefully look at these lesions. So if anyone's concerned about a spot that doesn't go away, you can certainly look up the way melanomas look or the way skin cancers look, but don't take it upon yourself to make that judgment. Go and see your physician. And certainly for me, selfishly so, your board certified dermatologist.
Thank you. Dr. Aguilera, what would you recommend as an aesthetic treatment now that people are emerging back in the world of post-COVID for mental and aesthetic therapy? I've heard you speak about this before.
Well, we all know that neurotoxins, and there's a lot of reports and papers written about how neurotoxins can help people combat depression itself, because there's a connection between the gestures that you make, and how you feel. So if you frown a lot of people probably worry, and you get the worry lines. By doing something as simple as making sure that those muscles are not sending that message to the brain, it will elevate the mood. So right now, a lot of people are worried, and I saw a question from Lori Castle. Do you think there will be any hesitancy for people to come back to getting procedures? Right now, it doesn't seem to be the case. I am completely packed. People were calling me, texting me, DMing social media when I was going to open. I also lived through the recession of 2008, and that was when I went solo and I opened for the first time. People, I thought it was going to be a catastrophe for myself and my career, and I ended up growing 64%. And history has shown when we as humans go through something bad, we want to feel good about ourselves. So anything that has to do with hair, nails, makeup, and aesthetic procedures, there are recession-proof type of procedures or businesses. So I don't see it. I see that people are not going to be able to do expensive procedures, but they're going to be able to save up and do smaller procedures. Like people are not going to be getting facelift just right now, but some will. But things like injectable fillers, neurotoxins, little procedures that's going to make you, even just a facial, that's going to make you feel like you're pampering yourself, that's going to make you feel good about yourself, it is helpful. It also will help you boost your immune system, like Tammy said. Anything that you do to pamper yourself, to acknowledge yourself, is beneficial. So I expect to maybe, right now I'm booked through July, maybe there may be a little dip because people are gonna be like, oh my God, maybe I need to save money. But all type of businesses are recession proof because people are never going to stop worrying about what they look like or what I feel like. And remember, a lot of people lost their jobs. So we still have to worry about that first impression. If you see a lady coming with gray hair, showing gray hair, and one is well put together, maybe she's gonna get judged as, look, she doesn't even care about herself. How's she gonna perform in her practice or in her type of business if she's somebody that doesn't even take care of herself? So people are gonna feel pressure to look their best because they have lost their jobs and they need to come out to the workforce. Also, they may feel like if they don't look the part or they look older, they may be replaceable by the younger generation. So this type of business, the beauty industry, the type of business that are recession proof, because people are always going to worry about what they look like. It has nothing to do with vanity. It has to do beyond vanity. It has to do about well-being, and it has to do with the fact that we do feel like we're getting judged if our hair, nails, and even your teeth don't look up to par.
Thank you. You know, I was so excited when we started this whole Zoom technology. I felt like I was a TV star till I saw my face on here and I realized I have a great face for radio. So there's a lot of people.
You look fine. You look
Thank
great.
you very much. Yeah, I can't wait to get a haircut. Dr. Fairman, this was an anonymous attendee, but it probably could be just about a lot of people we know. Is it beneficial to start getting Botox injections in your 20s versus 30s or 40s?
That's such a great question. That's really a very valuable question. So, yes, the answer is the long-term answer. The short-term answer is yes, it is beneficial. So what happens is the sooner we start addressing our own wellness and beauty, the more we are connected with ourselves, and the more we'll take care of ourselves and live out our healthiest and best life. So what happens is, I had a patient the other day, pre-pandemic, I remember a couple of months ago, and she was about 60. She was just starting to do little things for herself for the first time. So clearly she had a little ways to go because she'd never done anything else. She said to me, you know, my daughter is 40, right? Because she was 60. She said, is it too early for her to come? I said, no, my sweetheart. My children come to my space. And she looked at me and she said, your children? My kids are, I have 5 kids, 12 to 22. And I said, well, clearly I'm not injecting my children with Botox or doing liposuction on them. But what I am doing is exposing them to our holistic esthetician. So the teenagers, my girls 14, 16, and my son 19, are getting skincare for their acne. My son, who is an athlete, 19 years old, is getting massages, is getting lymphatic drainage. So I'm getting them to start understanding what self-love and self-care looks like, and what a better way to start it when you're younger. So honestly, you can start with this as teens, meaning start taking care of your skin, start taking care of your overall health and your lifestyle modifications, diet, nutrition, exercise, de-stress, all of these things that can support your wellness. And then, of course, once you're in your 20s and 30s, Dr. Aguilera and I, we start evaluating the aesthetics and looking at the global aesthetics and deciding where you would benefit. I have to tell you, I have a lot of patients in their 20s and 30s that start with the tiniest amount. Usually it's about 10 units of Botox or Dysport, might be just between the brows or just a little bit up high. And I'll be honest with you, there are people that will have very deep lines that are just genetic, and they see it on their father, on their mother, and they're in their 20s and they're seeing it. Well, you know what? It's time to address it. Actually, just reminded me, my cousin out in California, one of her sons is 25. He's in Harvard Law School, doing online now, of course. He has the deepest glabellar crevices you have ever seen. And she said to me, he's finally asking, do I do anything about it? Absolutely. If you start injecting little bits of neurotoxins, possibly little bits of filler, collagen stimulating products and hyaluronic acid, you will have a much softer aging process. And lastly, you're beginning your process of consciously aging so that you don't have to be in a mindset of anti-aging when you turn 60, like, oh my gosh, turn the clock back. No, you can actually start a little bit earlier. Of course, we start wherever we are. Okay, so whenever you start is the perfect time. But if you can start educating yourself and getting the consultations. And I just wanted to ask one last thing, is we're also doing telehealth consults, which is a beautiful new thing for me. And it's a lovely thing because usually I have my patients flying in and having all their consultations in-house. But I have to tell you, it's been a beautiful way to connect and have people get feedback and get the benefit of my expertise and start creating a plan for themselves of how to proceed. So yes, it is always the right time to get an evaluation to see if you're ready for your injectables by a board certified professional.
That was going to lead me into my next question. The three of you have thriving practices. Before COVID-19 hit us, it was impossible, very difficult to get an appointment to see the three of you. And I'd have to imagine that with people not being able to get out of their places for the last 60 days, those schedules are going to get even tougher. What are your theories on using telemedicine to communicate with your patients? Not only is it going to be the new normal, but is that going to free up time to be able to see more people? Why don't we start with Dr. Glick?
Yeah, I think so. Starting, it's 2 months now, I've been doing telemedicine, been on so many of these webinars, and telemedicine is here to stay. There's no doubt about it. I would like to think of it as a positive in my practice. It can become challenging and cumbersome, the technology, not everyone's comfortable handling it, but for the most part, most of my patients, when we get on and we have this two-way synchronous video, we do FaceTime together, it's been an incredibly positive experience. And I think it will enable me, and it has already, to flow my practice a little bit differently. And to your point, Jeff, some may think, well, you know, it's been closed for 2 months, I should be able to get right back in. And I can tell you, I worked this morning, it really wasn't very busy. We're at about 50%, just like Dr. Aguilera said. But on the other hand, we've also have about 2 months of patients that we have to navigate back into our practices. And I do a lot of dermatologic surgery, and so I'll have to be doing that too. So our acne follow-ups, some of the more simple psoriasis follow-up, you have several hundred patients on biologic therapies, the injectable medicines for psoriasis and eczema. We can probably handle a lot of that through telemedicine. And for the most part, it's been great. And I think it's going to teach us to flow our practices much more efficiently. I have to also say, Jeff, that in the chat box, someone had asked if there was anything new for psoriasis. There are tons of things that are new for psoriasis, and certainly you can consult with your dermatologist accordingly, but there are innumerable biologic therapies. We have these highly targeted therapies that are way safer now than ever. Their side effect profiles are much lower than the older generation products. And there are many questions that come up about, is it okay to start it during the COVID-19 pandemic or not? I think that's certainly a question to be asked between patient and doctor and solved accordingly. I could always give you my opinion on that, but I wanted to answer that question that I saw come up in the chat box.
Thank you. Dr. Aguilera.
Yeah, I think telemedicine is going to be something of the future. I have not implemented yet, although we are implementing it. I don't see new patients. I don't take new patients. I haven't for almost 3.5 years. So if I'm going to use telemedicine, it won't be for consultations. It's going to be just for maybe adverse reaction. If the patient have a question, I'm going to say, you know, something like this, and let me see, and basically manage any question, adverse reaction, or consultation for my existing patients. But for my other providers, I think they're going to be using it for new patients and trying to do maybe consultation. Because remember, we're trying to keep patients from being, you know, passing by each other on the waiting areas, just trying to make sure until those changes. I think telemedicine is going to be a lot of help for us to achieve those goals.
Great. Dr. Fairman.
Yes, I appreciate that question. Telemedicine is new to my practice. It was not something I was doing before. We were accommodating everybody. And yes, sometimes people need to wait a little bit, but it is our priority to give the utmost attention to everyone. So I'm really enjoying the telemedicine. Not only am I meeting new patients online, I love the way that we can really engage in sharing our energies. It's not the same thing as just being on the phone and answering questions that way. So I think that this modality is actually a beautiful way to get a feel of your doctor's personality, you know, of who they are, how they work, if they have a silly sense of humor, which I'm guilty, you know, whatever it is, and to see if it connects for you. So I see a lot of surgical consults, patients who might be seeing 3, 4, 5 surgeons, you know, as second, third opinions. And it is important to make that personal connection. And I feel that this is a beautiful way to do that. And the beautiful thing is the technology is good. The cameras are pretty good, whether we like it or not, we like the lighting or not. So we are able to do and see a lot through this technology. I think it's a beautiful way to connect. I do think it's going to open up more time for me in my practice to set aside, you know, time to see patients like this. We have the virtual background you guys can see behind me. So, you know, for all you know, I'm in my shower, but I think that I can do these consultations, you know, we can all do them anytime, anywhere. And I think that is going to open up a little bit of space. I just wanted to take a moment just to mention, somebody asked a question in the chat about clean skincare products. And I wanted to let everybody know that we do have a holistic organic skincare line that we do use. We use the line that's called Naturopathica, which is a completely natural line. And the reason that we do that is to try to minimize the chemicals that the skin is absorbing so that we're having the most beneficial effects of the skincare and minimal toxicity, of course. And the other thing I wanted to say is that the goal of my practice in terms of facial rejuvenation, and like Dr. Aguilera said, not too many people are going to be running for a facelift right now. And my practice, my surgical practice is really body contouring. So I do breast, belly, body surgery, mommy makeovers. But in terms of from the neck up, I really work more in the minimally invasive realm. And I think what patients are going to be learning is that the beautiful thing when you're using the products and you're doing the treatments and getting your consistent facials or peels or whatever that is, and your injectables in between, you actually are creating a long-term plan. So it's not like in a month everything disappears and you look like, you know, your great-grandmother. You actually can maintain on a daily basis the results. So you can go through a pandemic and have 2, 3, 4 months where you're still feeling pretty fresh and then come in for your touch-ups. So I think that's the goal, is to create regimens that are really long-lasting. They don't have to be super expensive. So I think it is affordable to everyone. To me, the most important thing is education. Education is empowerment. Seize the moment. In my practice, we offer those complimentary consultations. You are welcome to get online and have that consultation with me or my esthetician. And I think once you are empowered to do that, and with the other doctors as well, of course, then you will make a plan and make the decisions on how to proceed.
The time is flying by in this. I'd like to end this as asking each one of you this question. What words of recommendation or advice would you just like to give everybody out here in little TV world, or for your patients or potential customers that are listening in, as we all go through a very, very difficult time? Dr. Glick, want to take a stab at that?
Yeah, I just stay positive. I'm so hopeful. I want to be hopeful and positive every day. I try to bring that into my life and into practice. You know, stay strong, be healthy, take this opportunity to maybe do something different. Like Dr. Fairman said, you know, when you have that look in the mirror, maybe think about what's different right now and what I can do better, how I can change my life moving forward. And that not only impacts you and your health, your well-being, but those around you.
Thank you. Dr. Aguilera.
So I have a few. It's usually what I'm telling everybody, my patients, my family, my friends, and whenever I had the opportunity to talk with people on webinars. Number one is pledge to be better. Never before humankind had an opportunity to retreat back to our home and trying to reflect and introspect and look at our life and see the way we were conducting and the way we should change, and or you want to continue to be the same person. A lot of people talk about, let's go, I want to go back to normal. We cannot go back to normal because our normal wasn't that great. Look what we were doing to Mother Nature. So let's pledge to be better, whether it takes, like, for example, I'm learning Portuguese. That's a little thing that I'm doing for myself to be better. I also take webinars so I can improve my craft. Number two, learn to live with risks. Become a life warrior. And the way that you can become a life warrior is that you need to, like Tammy says, you need to learn to align yourself of mind, body, and spirit. You have to do the things that's going to improve your lung capacity. You know, where you ended during this pandemic at home without exercising, or you went out there and started doing jumping jacks or running. So do things to improve your lung capacity. Meditate or pamper yourself so you can actually align yourself with your spirit at the same time. And the last one is the power of the human touch. It's very important. Without the human touch, we will not thrive. We need human touch to thrive. And now that we can actually be wearing masks, it's very important to acknowledge somebody. So make sure that when it was bad enough that I used to get on the elevator and I would say, good morning, and everybody would grab the smartphone and look down like I was crazy or have 3 eyes. Make sure that you acknowledge another human being, because since we cannot touch and hug like we used to, at least make sure that you validate that somebody else is there, that you acknowledge them. The power of the human touch is important because without it, we will not thrive.
Thank you so much. Dr. Fairman.
I'm feeling so inspired by these two guys. I don't know. I'm ready to
Aren't they something else?
I want to be touched, and I want to be, I'm just so inspired. Thank you guys. I have a couple of points as well. The first thing is to become your own beauty and wellness and health advocate. We no longer need to throw the ball over to some professional, some doctor, someone else in creating health and wellness for ourselves. Individuals, patients, we as individuals are beginning to take ownership of our own health. So take the time to pause right now. Give yourself permission to pause, because the universe has given you permission to pause. You're home, you're waiting. I invite you to consider there's nothing to wait for. This is the time to act, to begin to think about what beauty and wellness in your life will look like, including taking care of your health, like skincare, as Dr. Glick said, that's an absolute priority, and other areas of your general well-being in terms of your body health. And also look at beauty and wellness. How does that play a role in your life? I also want you to consider that when you start walking the walk and taking care of yourself in this self-love, self-care fashion, you're actually modeling it as well. So I have the gift of having 5 children to model for, and family members, maybe a partner. The beautiful thing is, once you start being that advocate and taking care of yourself, you're actually spreading that love, and others are learning from you. So what I want to say is, love yourself. Begin with one ritual that you can think of on a daily basis, and you can do it for a whole week and then add another one. Don't overdo it. Just something that you commit that is not negotiable for you, that you say, you know what, this is my little love bubble. I'm going to sit and read the book that I love for 10 minutes, or I'm going to do a consultation with one of my favorite doctors for a few minutes, because self-love and self-care is all of it. It's breast implants, it's liposuction, it's the touch of a loved one, and it's the neurotoxins, the Botox, and the facial injectables. All of that is incorporated in self-love and self-care, body, mind, and soul. So just start today.
I got to tell you, the 3 of you guys were great. This was so helpful and so inspiring, and I can't thank you enough for joining Lifestyle Live today. I would also our events and marketing manager, Olivia Bibby, for their assistance today. We couldn't have put this on without them. I also want to finally thank our viewing audience, and 2 things. Remember, we'll get in touch with you with the beautiful and thoughtful gifts that our panelists are giving us, and to sign up for our daily newsletter. With that, I want to wish everyone a safe and happy weekend, and thank you, everybody.
Thank you so much for this opportunity.
Thank you so much.
Thank you all.
Annie, Shino, take care.
Be well.
Take care, you guys.
Thanks, Brad, Shino, Jeff. Be well.
Bye.